Onwards and upwards. We're going to have Dr. Leonard Dimberg from Sweden again to present a interesting research project that he's been involved in terms of low back pain. I know that's something that you don't see very much of anymore. Dr. Dimberg will be presenting the Mastercare inversion system and the results of his research with that system and how it might be beneficial for patients. Dr. Dimberg.
Thank you, Dr. Kopp. You have the slide. Thank you. Yes, I'm going to tell you a little bit about the study of inversion therapy that we've done at our plant. And the other authors, beside myself, is Lars-Göran Josefsson, the physiotherapist, and the statistician Bo Eriksson, that have been involved in this particular study. Now, the inversion therapy has been known since the days of Hippocrates. He used a special arrangement where the patient was hung upside down with his feet tied to the rungs of a ladder. By ropes over a pulley, the ladder was hoisted vertically and dropped, imparting an abrupt tractive force to the spine. So let me have the first picture, please. Now the theoretical proposed effects by inversion therapy, by head-down hanging, is to increase the mean intervertebral foramina height, to give increased space for nerve roots, and to reduce the extent of lumbar disc prolapses. As you can see, a disc prolapses here, and this is a herniated disc, you can see. If you give me a pointer. This is a herniated disc on a magnetic resonance image, and the proposed effect is that the disc would reduce the extent of the pressure within the spinal canal. Other proposed effects is stretching of the paraspinal muscles, if you have a muscle cramp in the back, and also stretching of the anterior or posterior longitudinal ligaments. And apart from that, general relaxation effect. That's the proposed effects by the inversion therapy. Now, I was addressed by a manufacturer of Swedish inversion therapy tilt table, and was asked to do a study on that. There have been other studies published on inversion therapy. This is a study by Frederick Sheffield some 30 years ago, and here it was used a belt to keep the lower part up, and the body weight was stretching the back. This type of traction has been accomplished by other mechanisms, and there are a lot of back traction equipments all around, but none have been evaluated as far as I have been able to see in a prospective controlled study. This is particular boots, inversion boots, that were used in the film The American Gigolo, and was popularized by the film and has been used by many people in this country. This is the way the Swedish inversion system looks, and as you can see, there is a tilt table that you can tilt backwards, and there is a padded roll that you have along your ankles. We have the equipment outside here for you to try afterwards. Now, The background is that it has been estimated that 15% of all sick days in the USA in the beginning of the 1980s was due to low back pain. And low back pain is a societal and industrial problem of major dimensions. Our hypothesis was that the regular use of the equipment at the workplace may have an effect on low back pain, back mobility, and sickness absenteeism among chronic low back pain patients. And a randomized controlled study was carried out over a 12-month period, of which 3 months were mandatory, from August 1992 to September 1993. Included were employees of Volvo Aero who had reported ongoing low back pain at the start of the study, or with sick days of low back pain totaling 3 months during the previous 3 years, or with at least 2 sick leave periods caused by low back pain of at least 1 week during the previous 3 years. Excluded were those reporting unwillingness to participate or who were on full-time sick leave at the start of the study. The design was that the employees were stratified into 3 groups with stratification of gender and worker category, and they were randomized to group 1 that trained for 10 minutes once daily, also using a special training program in the together with a tilt table. Group 2 used it for twice for 10 minutes daily, and group 3 served as control group. All participants using the Mastercare inversion system first received an individual instruction from an MIS instructor and registered their activities with punch cards. At baseline, a questionnaire was collected with information about age, gender, worker category, pain level on a visual analog scale, level of function, medication, other treatment, and reported sick days for the past 3 months. In addition to this, a pain drawing was completed showing the characteristics and distribution of pain. Measurements of back mobility were performed according to the Dimberg standardized procedure at baseline and 3 months, after 3 months. After 3 and 12 months, the procedure was repeated, and in addition to the data above, subjective impressions of the MIS therapy were requested from the participants. Statistical methods were analyzed by group comparisons and multivariate analysis. All tests used were two-sided. Now if we get the next picture. So all patients had to fill out a questionnaire, and they were measured with measuring techniques on the lumbar spine sideways, both sides, finger floor distances, and bending forward, left arm and right arm. And also using the Schuber method by 2 marks on the back, 5 centimeters below the dimples and 10 centimeters above the dimples of the low back pain, of the low back. Now, the results. Baseline parameters, we had 3 groups. Group 1 training once daily, 35 years of age, 35 persons. Group 2, 34 persons, and Group 3, 39 persons. And they were similar in relation to age, and there was some variation of the percentage of males and blue-collar workers in the different groups, but this was all compensated for with the statistical group comparison multivariate methods. This is the principle of the back traction. And there was also, in addition to this, an exercise program that was carried out during the training. These persons were followed for 3 months. That was mandatory, and those who wanted to complete the study, the 12-month study, did so. And of the 108 individuals that entered the study, 92 individuals completed the 12-month study. And what we could find is a statistical significant reduction of low back pain last month as reported in group 1 and 2 compared to baseline and compared to the control group. We also found increased finger floor distances when bending forward that can be interpreted as an increased back mobility. However, using the Schubert test, we did not find any significant difference. So this is hard to interpret if the back mobility really increased, since we used two different methods and only one method proved an increase of back mobility. Looking at the average sick days per participant, we collected total sick days during the period 6 months before the study, during the first 3 months of the study, and during the complete study. This is the 12 months study, and you can see group 1, 2, and 3 total sick days was a reduction in group 1 and 2, training once and respectively 2 times daily, and group 3, that was the control group, there was an increase from baseline 100% sick days per month. And for the low back pain, sick days for low back pain, there was a significant decrease in the second group, but not in the first group. Together, the groups, training groups together, had a reduction of, let's see here, of total total earned sick days 7.9 days per participant, and the sick periods for low back pain were also reduced during this 12 months follow-up, as you can see here. For the training groups, for low back pain, sick periods 50% from baseline in group 1, 65% from baseline in group 2, and about the same, 97% of baseline in the control group. So, in conclusion, a dose response correlated statistically significant improvement of low back pain was documented after self-training in the inversion system, and the training groups had fewer sick days, about 7.9 days per participant, and sick periods for low back pain after 12 months compared to baseline, in contrast to the control group, where a slight increase was seen. This finding was statistically significant regarding total sick days and sick periods for group 2 and sick periods for low back pain for group 1. The effect of the training on back mobility after 3 months was questionable. So, this is a study that we have used, and I now personally use the tilt table for patients with back pain and take them out after they see me in the clinic, and take them out and have them try with auto traction. And if they respond in a positive way, I usually let them continue after a brief instruction for a longer period of time.
How many of your patients had significant pathology on objective findings from an MRI or a CAT scan?
Yeah.
Let me have you go to the mic so everybody can hear your question.
How many of your patients had significant pathology documented by either a CAT scan or an MRI?
Well, we do not regularly do CAT scans and MRIs at our hospital, local hospital. So I can't give you the answer on that.
Okay. So these are people that were self-reported with
these
low back pain,
were
or they had lost work
self-reported, and they had been investigated by a physician at the plant, and all of them had a traditional X-ray, but no MRIs. So it's a mixture of different etiology for the back pain.
Okay. Thank you.
Dr. Baker.
A corollary or very similar question, were there specific criteria for inclusion into the inversion method of treatment, or conversely for exclusion of certain individuals with low back pain from that method of treatment?
The inclusion criteria was based on previous sickness absentees for low back pain, and all patients were recruited from the company files. So there were no specifically physical tests that we performed to include these patients.
Dr. Jackson?
John Jackson. How do you know that it wouldn't have been just as good to lie them down for 10 minutes? In other words, how do you know that it was the inversion rather than the rest or indeed the exercise that was achieving the benefit? That's
a very good question. The only reason that I think that the inversion had the effect is that it was reported by the patients in a very typical way when they lay down and they felt an improvement from the inversion as they reported. But of course, I cannot decide from the study, the design of the study, if it was the inversion or if it was the training program. On the other hand, no training program has been evaluated to have an effect for preventing low back pain problems.
Thank you, Dr. Dimberg.